Florida is making progress in reducing some workforce shortages, especially among nurses, but big gaps remain. Healthcare access and affordability continue to be significant struggles for many Floridians, especially in rural and underserved urban areas. The state legislature has enacted several laws in 2024-2025 aiming to address workforce issues, care delivery, quality, and financial protections. But budget proposals and policy changes threaten to undercut or alter some initiatives. Healthcare access and affordability, cost burden for individuals. Surveys show that a large share of Florida residents face burdens due to medical costs. These include delaying or foregoing care, skipping medications, or being uninsured. Though most recent publicly available survey data is from 2019, it remains relevant given slower policy shifts. Uninsured rates and insurance coverage. Florida historically ranks among the states with higher percentages of uninsured people. Urban-rural disparities are notable. Physician supply is much lower in rural counties. Facility access and geographic disparities. People in rural areas often have to travel further for basic primary care. Clinic hours and availability are variable. There are documented shortages in providers in some counties, e.g. on Florida's West Coast. Costs and insurance policy. Florida has considered reforms around how hospitals collect debt and billing practices. For example, HB 547 revises how ambulatory surgery centers, ASCs, and hospitals deal with extraordinary collection actions and medical debt. Medicaid and uninsured population issues persist. Even with large state spending, millions are still underserved. The insurer coverage landscape remains uneven. Workforce shortages. Florida hospitals have shown measurable improvement. The nurse vacancy rate dropped by about 62% from 2022 to 2024. Turnover rates among nurses and allied health professionals dropped by approximately 45%. Still, projections estimate a shortfall of nearly 60,000 nurses by 2035 if current trends continue. Some counties, e.g. Manatee, Sarasota, are especially hard hit, with open nursing positions remaining vacant for long periods. Education and training efforts. State programs such as LINE, Linking Industry to Nursing Education, and Pipeline have been expanded with substantial state investments to increase the number of nursing program completers. Advent Health and other health systems are expanding hiring and improving retention efforts. Example, better contracts, raises, addressing burnout. Legislative and policy changes. Live Healthy Act 2024, a broad legislative package signed by Governor DeSantis aimed at boosting healthcare workforce, expanding access, and promoting health innovation. HB 547 revises hospital and ASC billing practices, including changes in how medical debt is handled, especially around collection and selling of debt. Effective July 1, 2025. HB 1353. Expanded flexibility in home health services, including allowing contracted personnel to perform certain visits, and permitting single administrators to oversee multiple home health agencies under certain conditions. Effective July 1, 2025. Other laws include changes in stem cell therapy regulation, SB 1768, under strict standards and informed consent requirements. Proposed or threatened cuts, alterations. There is a push from some budget committees to eliminate or reduce the Health Innovation Loan Program, part of the Live Healthy initiative, which had been set up to receive $50 million per year for state health innovation projects. Also, in the same ballpark, oversight councils or programs meant to guide and monitor the innovation and workforce efforts are targets of proposed budget cuts. Emerging and recent issues. Vaccine mandate rollbacks. Florida has recently moved to roll back several vaccine mandates, including school vaccine requirements for some diseases, citing bodily autonomy and parental rights. Health experts are warning of potential public health risks increasing from this change. Medical debt protections. HB 547 represents one recent law aimed at strengthening financial protections for patients with medical debt. Challenges and risks. Sustainability of workforce gains. While nurse vacancy and turnover rates are improving, demand is still growing. Population growth, aging population, greater demand for chronic care. Sustaining these gains will require continued investment, better training capacity, retention strategies, and reduced burnout. Balancing cost and access. Affordability remains a central challenge. High medical costs, insurance gaps, and cost burden continue to threaten access. Delayed or foregone care due to cost can lead to worse health outcomes and higher long-term costs. Impact of legislative changes. Some enacted laws help, example, debt protections, home health expansions, but proposed cuts to innovation and workforce programs risk undermining progress. Also, vaccine mandate rollbacks may have downstream effects on vaccine confidence, disease incidence, and strain on acute care. Geospatial disparities, rural counties, underserved coastal areas, senior-heavy communities, especially in South Florida, and low-income neighborhoods see the biggest gaps in access, provider availability, and insurance coverage. Recommendations. Based on the recent data, here are some suggested paths forward. Maintain or increase funding for workforce development, e.g., line pipeline, innovation loan programs, to ensure continued growth in the health workforce. Address rural provider shortages via incentives, loan forgiveness, housing, travel compensation, telehealth expansion, and regulation that allows non-physician providers greater scope where safe. Strengthen financial protections for patients, particularly those with high out-of-pocket costs, medical debt, and inadequate insurance coverage. Monitor and mitigate impacts of vaccine mandate rollbacks, including ensuring public health infrastructure can respond if vaccine uptake falls. Enhance access to primary care by reducing barriers, insurance, facility hours, proximity to reduce overuse of emergency services. Conclusion. Florida is in a complex transition. The state's leadership has recognized many of the problems: shortages of nurses and other care providers, high costs, access gaps, and has passed laws and funded programs intended to address them. There is measurable progress, especially with reduced nurse vacancy and turnover, but significant risks remain. Projected workforce shortfalls, uneven access among populations, rising costs, and legislative and budgetary pressures that could slow or reverse gains. Continued attention, funding, and policy alignment will be critical in the coming years to ensure all Floridians can access affordable, quality health and wellness services.